What does it actually feel like when your veins are clogged or your circulation is poor? If you are over 50, you may have felt heavy legs at the end of the day, swollen ankles that leave marks from your socks, tingling in your feet, or strange cramps when you walk. Most people blame these symptoms on getting older, on being out of shape, or on standing too long at work. But in many cases, these are warning signs that blood is not flowing properly in your legs, your feet, or even your heart. In this video, you will learn 7 warning signs of poor circulation, how they show up in your legs and feet, and how they can be connected to heart and artery problems. We will explain in simple language what clogged veins really means, what tends to make circulation worse, what you can do at home to support better blood flow, and when these symptoms are a reason to see a doctor or go to the emergency room. Let's start with a simple truth. When most people say clogged veins, they are usually talking about any problem with blood flow. But medically, you have to separate a few different things. Your blood moves through a closed loop. Your heart pumps blood into your arteries. Arteries carry oxygen-rich blood away from the heart to your organs and muscles. Small arteries lead to tiny vessels called capillaries, where oxygen is delivered to tissues. Then veins carry blood back to the heart so it can be sent to the lungs, pick up oxygen again, and start the loop over. When there are problems in this system, they can happen in arteries, in veins, or in both. Arteries can become narrowed by fatty deposits called plaque. This is known as atherosclerosis. When this happens in the arteries that feed your legs, it is often called peripheral artery disease. Veins can become stretched and their valves can become weak. This can lead to varicose veins and chronic venous insufficiency, where blood has trouble returning from your legs back to your heart. And in both arteries and veins, blood clots can form and suddenly block flow. That is what happens in deep vein thrombosis in the leg, or in a heart attack, when a clot blocks a coronary artery. So when you feel something in your legs or feet and wonder if your veins are clogged, it could be one of several different issues. Some are uncomfortable but manageable. Some are medical emergencies. Understanding the warning signs can help you tell the difference and get the right help at the right time. Warning sign number 1. Heavy, tired legs. By the end of the day, your legs feel like they are carrying extra weights. They may feel heavy, tight, or achy, especially after long periods of standing or sitting. You might notice that elevating your legs on a pillow or lying down makes them feel better. Heavy legs often happen when blood is not returning efficiently from your legs back to your heart. Veins in the legs have small valves that help push blood upward against gravity. When those valves become weak or damaged, blood can pool in the lower legs. This increases pressure inside the veins. That pressure can make your legs feel full, heavy, and tired. This is common in chronic venous insufficiency, and in people with varicose veins, extra weight, long hours standing, and lack of movement can all make it worse. Many people shrug this off as just getting older. But if your legs feel unusually heavy most days, especially if it is new or getting worse, it is worth bringing up with your doctor. Warning sign number 2. Swelling in your legs and feet. You notice that your socks leave deep marks around your ankles. Your shoes feel tighter at night than they did in the morning. Your ankles or feet may look puffy, especially after a day on your feet or after a long car or plane ride. Swelling in the lower legs and feet is called edema. It happens when fluid leaks out of blood vessels and builds up in the tissues. There are many possible causes. Mild swelling at the end of the day can be related to gravity, salt intake, or standing still too long, but persistent or worsening swelling can be a sign that the veins are not moving blood back up efficiently. It can also be a sign that the heart is not pumping blood as strongly as it should. When the heart is weaker, pressure builds up in the blood vessels, and fluid can leak into the legs. Swelling that appears in just one leg, especially if that leg is also painful, warm, or red, can be a warning sign of a blood clot in a deep vein. That is called deep vein thrombosis, and it is a medical emergency because the clot can travel to the lungs. If you notice new, sudden, one-sided swelling with pain or color change, you should seek urgent medical care. If swelling is mild and comes and goes, but is happening most days, especially if you are over 50 or have heart, kidney, or vein problems, it is important to mention it to your doctor. Warning sign number 3. Tingling, pins and needles, or numbness in your feet. Your feet may feel like they are asleep more often. You may notice pins and needles when you sit or stand for too long, or you may have areas of your foot that feel less sensitive than before. Sometimes you may not feel cuts or injuries in your feet as easily. Tingling and numbness can have many causes. In people with diabetes, nerve damage called peripheral neuropathy is very common and can cause these sensations. Or circulation can also contribute when nerves are not getting enough oxygen and nutrients over time. If nerves do not get adequate blood flow, they can become irritated or damaged. That irritation shows up as tingling, burning, or numbness. This matters because when sensation is reduced, It is easier to miss injuries, infections, or pressure points on the feet. Those small problems can then grow into larger wounds that are slow to heal. If you notice new tingling, burning, or numbness in your feet, especially if you have diabetes, high blood sugar, or risk factors for vascular disease, this is a reason to talk to your doctor. Warning sign number 4. Cold feet or color changes. Your feet are cold even when the room is warm. You might find that one foot is noticeably colder than the other. You may notice that your toes or feet sometimes look pale blue or reddish purple, especially when you elevate them or when you are in a cool environment. These changes can occur when blood is not flowing well through the arteries that supply your feet. When less warm blood reaches the tissues, they feel cold to the touch. When oxygen levels drop, the skin can change color. In some people with peripheral artery disease, walking or cold temperatures trigger color changes and discomfort. In others, just sitting with the feet elevated can cause the feet to become pale, then red when they are lowered again. Occasional cold feet can be related to temperature or low thyroid function, but persistent cold, color changes, or a clear difference between one foot and the other can suggest reduced blood flow and should be evaluated. Warning sign number 5. Cramping or pain when you walk that goes away when you stop. You start walking and after a few minutes your calves begin to ache. The pain feels like a cramp, tightness, or burning when you stop and rest. It slowly goes away. When you start walking again, the pain comes back in about the same place and after about the same distance. This pattern is called claudication. It is a classic sign of narrowing in the arteries that supply your leg muscles. When you walk, your muscles need more oxygen. If the arteries are narrowed by plaque, they cannot deliver enough blood to match the demand. Your muscles then send pain signals. When you rest, the demand drops and the pain improves. Claudication is often described as angina of the legs. Similar to how chest pain with exertion can signal narrowed coronary arteries in the heart. People often dismiss this as just getting older or being out of shape. But predictable pain in the legs with walking that improves with rest is not normal aging. It is a reason to ask your doctor about peripheral artery disease. Warning sign number 6. Bulging, twisted veins and aching in your legs. You may see veins under your skin that are enlarged, twisted, or rope-like. Your legs may ache, throb, or feel restless, especially after standing for long periods. These are common signs of varicose veins and chronic venous insufficiency. In this condition, the valves in the veins do not close properly. Blood leaks backward and pools in the lower legs. This increases pressure and stretches the vein walls. The result is visible varicose veins, heaviness, aching, and sometimes itching or skin changes. Varicose veins are not the same thing as blocked arteries. They are usually a problem of the surface veins, not the deep arteries that carry blood to the muscles. But they are still a sign that the venous side of your circulation is not working optimally. They can also increase the risk of skin changes and ulcers around the ankles. If your veins are becoming more prominent, if you have persistent aching or heaviness, or if you notice darkening or thickening of the skin near your ankles, talk to your doctor about options. Warning sign number 7. Shortness of breath, chest discomfort, or palpitations linked to poor circulation. Most of this video focuses on your legs and feet, but poor circulation is not just a problem of the lower body. Your heart and lungs are part of the same system. When blood flow is impaired in your arteries or veins, it can stress your heart. If you have heavy, swollen, or painful legs, and also notice that you get short of breath more easily, or you feel chest pressure or rapid, pounding heartbeats, this may be a sign that circulation problems are affecting your heart as well. Shortness of breath with minimal exertion, chest tightness, or a feeling of pressure in the center of the chest are always reasons to take action. If these symptoms are severe, sudden, or combined with one-sided leg swelling or pain, this could be a sign of a blood clot that has traveled to the lungs, called a pulmonary embolism, or of a heart problem. Those situations are emergencies. Do not wait to see if they go away. Call emergency services immediately. Now that we have covered the 7 warning signs, let's talk a bit more about what is happening under the surface. Circulation is the delivery system of your body. Your heart is the pump. Your arteries are the high-pressure pipes carrying blood outward. Your capillaries are the tiny exchange points, and your veins are the low-pressure return lines bringing blood back. If any part of this system fails, the whole system is affected. When arteries narrow due to plaque buildup, muscles and organs downstream do not receive enough oxygen, especially when they are working harder. When veins fail to return blood efficiently, fluid can leak out, causing swelling and heaviness. When clots form, they can suddenly block flow and create pain, swelling, or life-threatening complications. Certain factors make all of this more likely. Smoking damages the lining of your blood vessels and speeds up atherosclerosis. High blood pressure puts constant extra force on artery walls, making them more likely to stiffen and crack. High LDL cholesterol contributes to plaque buildup in arteries. Diabetes can damage both blood vessels and nerves, increasing the risk of poor circulation and making it harder to feel warning symptoms. Excess weight and a sedentary lifestyle add strain to your heart and vessels. Long periods of sitting or standing still, such as on long flights or at certain jobs, can slow blood flow in the legs. Age also plays a role as we get older. Blood vessels lose some of their elasticity and problems that have been building for years start to show up as symptoms. Family history matters too. If close relatives have had circulation problems, heart disease, or blood clots, your own risk may be higher. Now, what can you do to support better circulation at home? Some changes are basic, but powerful if you smoke. Quitting is one of the single most important steps you can take for your arteries and veins. Even after years of smoking, stopping can improve blood vessel function and reduce your risk of clots, heart attack, and stroke. Moving more helps your muscles act as pumps to push blood back toward your heart. Walking, even in short bouts of 5 to 10 minutes throughout the day, can make a difference if you sit for long periods. Set a timer to stand up and move around at least once every hour. If you stand a lot for work, try to shift your weight, flex your ankles, and take brief walking breaks when possible. Elevating your legs above the level of your heart for short periods can help reduce swelling and heaviness. Talk to your doctor about whether compression stockings are appropriate for you. They can help support the veins in many people, but they are not right for everyone, especially if there are significant arterial problems. Diet matters too. A pattern of eating that emphasizes vegetables, fruits, whole grains, legumes, healthy fats like olive oil, and fish has been linked to better vascular health. Reducing highly processed foods, excess salt, and added sugars can help support blood pressure, weight control, and overall circulation. Staying well hydrated helps blood flow more easily. Extreme dehydration can thicken blood and may contribute to clot risk in certain situations. Although hydration alone is not a guarantee of safety. If you have diabetes, keeping your blood sugar well controlled is crucial for protecting both your vessels and your nerves. Now, just as important as what you can do at home is understanding when home care is not enough. So when should you see a doctor? And when should you go straight to the emergency room? You should talk with your doctor if you have and heavy, tired legs most days of the week that improve with elevation, and ongoing swelling in both legs or feet, especially if it is getting worse, and tingling, burning, or numbness in your feet that is new or progressing, and cold feet or color changes that are persistent or different from one foot to the other, and cramping in your calves or thighs that appears after walking a certain distance and improves with rest, and varicose veins with aching, heaviness, or skin changes around your ankle. And these are warning signs that circulation is not ideal and deserve evaluation. And you should seek emergency care immediately if you have. And sudden, severe pain in one leg, and sudden swelling in one leg, especially if it is painful, warm, or red, and sudden shortness of breath, chest pain, coughing up blood, or feeling like you might pass out, and chest discomfort, pressure, or tightness, especially with shortness of breath, sweating, or nausea. And these symptoms can indicate a blood clot in the leg, a clot that has traveled to the lungs, or a heart attack in those situations. Do not wait to see if things get better on their own. Do not drive yourself to the hospital, call emergency services. If your symptoms are less severe but concerning, contact your healthcare provider as soon as possible and describe exactly what you are feeling, how long it has been happening, and whether anything makes it better or worse. Your doctor may recommend a physical exam, blood pressure checks in your arms and legs, blood tests, or imaging studies such as an ultrasound of your leg veins or arteries. The goal is to find problems early, and they are easier to manage and before they cause serious complications. Let's recap the 7 warning signs of poor circulation and clogged vessels in your legs, feet, and heart. Warning sign number 1. Heavy, tired legs, especially at the end of the day, that often feel better when you elevate them. Warning sign number 2. Swelling in your legs and feet, especially if it is persistent, worsening, or shows up on just one side. Warning sign number 3. Tingling, pins and needles, or numbness in your feet, particularly if you have diabetes or other risk factors. Warning sign number 4. Cold feet or color changes in your toes or feet, especially if one side is different from the other. Warning sign number 5. Cramping or pain in your legs when you walk that goes away when you stop and returns when you start walking again. Warning sign number 6. Bulging, twisted veins, and aching in your legs, especially with heaviness and skin changes around your ankles. Warning sign number 7. Shortness of breath, chest discomfort, or palpitations that occur along with leg or foot symptoms, and suggest that your circulation issues may be affecting your heart or lungs. If you recognize more than one of these signs in yourself, especially if they are getting worse or limiting your daily activities, talk to your doctor. Do not dismiss everything as just aging. Your body often whispers before it screams. Listening to those whispers can prevent bigger problems later. If this video was helpful, subscribe for more health information for adults over 50. Share it with a friend or family member who has heavy legs, swollen ankles, or cold feet, and thinks it is just part of getting older. Remember, this video is for educational purposes only. It is not medical advice and should not replace care from a qualified healthcare provider. If you have sudden leg pain and swelling, chest pain, shortness of breath, or any worrying symptoms, seek emergency care right away. Do not drive yourself to the hospital. Call emergency services. Every person's situation is different. Work with your doctor to understand your specific risks and create a plan that is right for you.